I've been involved in, rehab since I was 17, been in trouble since then. I've stayed in rehab, been through it so many times. It's like if I'm not in jail, I'm in rehab. And it was just a vicious cycle. Alcohol was my demon. Really, that's the only time I used to be able to do anything is when I was drunk, because that's the only time I was normal. I was self-medicating. That's really what it was. I mean, I wasn't having fun. My life sucked. I mean, it sucked so bad. I wanted to die. I kept getting made to go to IOP, and my anxiety was so crazy. It's like after I go to these classes and all I want to do is drink afterwards.
The folks that we're really looking at are folks who have a pretty significant co-occurring disorder that has really affected their ability to get clean and sober and stay clean and sober long term. And as we talk about people who'd fall through the cracks, they are really likely to be people who are not effective in traditional treatment. Oftentimes it's just because they don't, treatment doesn't have the resources to actually treat the co-occurring issue as it's happening.
I'm a longtime patient with Centerstone. I've been with Center for Behavioral Health before it was Centerstone since I was 19 years old. I was originally involved because of mental health issues, bipolar, depression. Then later I was involved strictly from an addiction standpoint, and when I heard that they had a program that was combining the two, I came running in, literally. It's been invaluable from an educational standpoint, just understanding that I'm not just crazy, that the mental health issues and life issues and addiction issues all combine, and that there's a solution to the problem. I often struggle with suicidal tendencies, and just having somebody here that understands my issues and that I'm likely to go out and self-medicate because I'm feeling so bad, or that the medication's not working. I know that without a program like this at Centerstone, I would not have made it. My life would have become very tragic.
So what Centerstone has found and what SAMHSA is supporting is that an ounce of prevention is worth a pound of cure. Instead of putting all of these resources into folks after they've gone through crisis, after someone has been suicidal, after they've had legal issues, instead of putting our resources into that process, if we can put the resources into the prevention, into education, into building the connections between the different resources in the community, what we found that even though we have a grant that's spending money up front, in the long run, that's a lot less of an expense than addressing the issues that come up later after someone has been through crisis.
I started coming in because I was addicted to cocaine. So they told me about the co-occurring program and said that I could possibly be bipolar or dual diagnosed. I never once thought about that. And they introduced me to the program and see what I like to come. And I found out that not only was I addicted, that I had other issues that I hadn't dealt with that caused me to continue to go back out and use.
Clients coming into the program, of course, with the co-occurring, need their issues addressed both in the mental health and addictions realm. We'll discuss mental health needs, addictions needs, life needs, case management needs, whatever is really pressing within the group. Quite often the goal is to look at how they're all integrated and how addressing addictions concerns can make a positive impact on the mental health needs. Addressing mental health needs can help with recovery.
It's a very targeted intervention that's really focusing not only on their addiction but also on their mental illness and really giving them treatment for both at the same time.
When I started going to the co-occurring class, at first I was like, okay, what is this? Because I've been in therapeutic treatment centers all my life. So this was something new, and they focused on the mental issue of things that I hadn't dealt with, like my kid's dad's death, all the times I was away from my kids, all the guilt and all the shame that I was carrying around and couldn't get past it because I didn't want to feel it, and I always went out and used. So the co-occurring program taught me how to work through those issues and to feel whatever it is that I was feeling, and to know that it's okay to feel what I was feeling without using.
Entering into a strange group with folks that you don't know, and the expectation to share your deepest, darkest personal issues is challenging for anyone. For folks with co-occurring issues, there's still a challenge that it's perfectly acceptable to come in and talk about recovery-related issues and addictions issues, but not necessarily depression, anxiety, bipolar, hallucinations, schizophrenia, delusions. That's still perhaps considered a stigma and uncomfortable for them to share. A
lot of people that are in, regular IOPs like I was for so many years, I never talked about, those problems because I felt like I was stereotyped as like somebody who's crazy or whatever, and people get scared of me and stuff. I wasn't relating to these people. These people, I mean, we're not the same. I'm a Martian. It's hard to be in people like me when you have to go to those places. They've already told me I'm an alcoholic. Now they're telling me I'm other things. It's hard to do. It hurts your pride. But when you're around people that are like that, I mean, it's pretty much the greatest thing that could happen to you.
Once a month, the clients participate in a job training class. We do a variety of activities: cooking, computers, interviewing skills, updating a resume. They bring in speakers to talk about what employers are looking for. And so we bring groups of clients from both of our offices, the Jeffersonville office and the Bloomington office. Clients get to spend some time together, get to know each other, share their stories, share their experiences. They learn that there's a lot of similarities in their stories, but it's good for them to meet each other and hear similar stories and know that they're not alone.
Being able to bring folks together in one group where they can share common experiences, the ability to relate to one another. And there's a lot of power in the ability to realize that although different from the traditional chemical dependency model, there are other folks like them that are struggling with similar issues and have found a way out and have found support and found ways to manage both their recovery and their mental health issues in an integrated way and live a healthy life.
My past does not define me. I made wrong choices. I didn't know how to really cope with life. I didn't know how to live normal. I was used to chaos. I was used to going to jail. It had became a routine, something like a merry-go-round that I couldn't get off of. And now it's like being clean. It's like my eyes are open. It's like, wow,
When I was, still drinking, I pretty much accepted the fact that I was gonna live like this until I died. That I accepted I was just gonna be a drunk and I was just gonna die early. I don't want to be old, so I just kind of gave up. And I got into this group, and I've been in it for I think 2 years, and I haven't drank any alcohol in 11 months. They understand that if you mess up, throwing you back in jail is not going to solve the problem, and I think it's more suitable for people like me because I wasn't comfortable in the regular IOP because I got problems. We're not like the regular normal people, and it's cool because I can talk about it and don't have to worry about people judging me or whatever. And I guess just getting over it. The dual diagnosis really, helped me do that.